Hello and welcome to the health program on Trust Television. I am Aisha, Salihu. On this week's episode of the program, we're taking a look at the ethics and impact of nurses and the nursing profession in advancing Nigeria's healthcare system. Joining us on the program today is Mero, Adah, who served as a nurse at the National Hospital and is now retired. Let's begin with the backgrounder on the role of nurses. A nurse must provide care to all members of the public without prejudice to their age, religion, ethnicity, race, nationality, gender, political inclination, health, or socio-economic status. Uphold health consumers' human rights as provided in the Constitution. And now to my first question. Let us look at, say, the importance of nurses in the Nigerian healthcare system today. I'd like to hear from you. What would you say is the reason, or why is it essential? Why is it crucial, the role of nurses in Nigeria's healthcare system today?
Thank you for having me here. The role of nurses in healthcare cannot be overemphasized. A nurse is trained primarily to take care of patients in any health facility. Like you just said, irrespective of their age, status in society, religion, and what have you. A nurse is the first person a patient meets in any healthcare facility. And as such, a nurse should be somebody that should be trusted by the patient. A nurse should be loving. A nurse should be all-embracing because you are there to take care of patients.
I know you have spent a number of years in the profession and you are now retired. I'd like to hear from you. What would you say is the historical background that shaped nursing in Nigeria?
Well, nursing in Nigeria dates back, as I've forgotten the exact year now, but it started from Florence Nightingale, who is called the Lady with the Lamp. And she started in Calabar. She's a foreigner who came to Nigeria and was based in Calabar and started caring for patients, for people, so to say. Then, that is the background of nursing in Nigeria. And that was where caring started until it was institutionalized by the government. People are brought into school of nursing and trained for 3 years. Exam set, you pass, and you are licensed to take care of patients. Yeah.
Now, I'd like for us to look at it on a broader perspective. I know that nurses do not just exist on their own. We have heard nurses and midwives. I'd like for you to just clarify that for us. What is the role of the nurse? How is it different from that of the midwife?
A nurse, like we know, is a general nurse. You are trained to take care of patients in all strata of healthcare. While a midwife is trained primarily to take care of of a pregnant woman, take delivery, and take care of the patient post-delivery for like 6 months before the woman is discharged out of postnatal care.
Now, I'd like to know, how would you describe the relationship between nurses and doctors? Because we know that both experts work hand in hand.
Yeah. There's no rivalry. No nurse is subservient to a doctor. We are all trained in our various fields and we work together for a common goal. That's the total care of the patient. Yeah.
I hear you when you say no nurse is subservient, but then you would agree with me that over the years, during the course of the practice, we have seen nurses who have taken up roles of midwives, who have taken up roles of doctors. What would you say is the reason for that, and how do we ensure that we draw the line?
Well, lines are already drawn by your training, so you don't step into somebody else's field. But you are trained in such a way that if there is no doctor, you will not leave the patient wallowing in pain without being taken care of. So you step in, but you have your boundaries. Equally, a trained nurse cannot take totally the role of a midwife. You have your boundaries there equally. So when you know your boundaries, you don't go beyond your boundaries or you are looking for trouble. Yeah.
So in line with so that you don't go beyond your boundaries, I'd like for you to state it categorically how nurse and doctor's relationship has evolved over time, say, still in line with delivery of healthcare.
Yeah. A nurse primarily is in charge of the patient. Like we all know, in hospitals, nurses run 3 shifts. Doctors just come in to see the patient, see the overall well-being of the patient, clerk, prescribe their drugs, and walk away. The rest is left for the nurse to carry out. And it's not only the doctors that co-manage patients with nurses. Healthcare is a multifaceted, disciplinary place. You have physiotherapists,
right?
You have dietitians, you have the nutritionist. Everybody comes into play as it is warranted by the condition of the patient. So we don't just deal with patients, doctors, sorry. We also deal with other professionals.
Okay, so I hear you. I understand now that nurses equally have areas of specialty and expertise, just like the doctors.
Absolutely.
Now, this now brings me to the ethics of the profession.
Okay.
What would you say highlights the major ethics of the profession?
Well, the highlight of nursing profession is that you take each patient as an individual. And your nursing care for that patient should be holistic, because everybody is an individual and you take them up as such. You don't compare to individuals, because we are all born differently, raised differently. We have different values, so you pick up a patient as an individual and you take a holistic care of the patient.
Okay, so in line with taking patient as an individual now, what role does trust play? Because I understand that before you can actually administer care to an individual, there has to be somewhat form of trust, right?
Yeah, absolutely. You have to be open to the patient. You have to respect the patient to earn his trust. You don't lie to a patient and feel the patient to still trust you. So you be open, tell them the truth about everything you know. You earn somebody's trust by respecting the person, addressing the person properly. I will not come to my patient and say, hey, I should know your name and address you as such. I will not say allergy, because everybody can be an allergy. You have to be specific and you have to talk. You communicate appropriately with your patient. Yeah. And that way you earn some trust.
Okay. I know earlier you stated that as much as these health experts exist together to deliver healthcare, they all have to stick to their training and their areas of expertise. Yeah. And this now brings me to the challenges that nurses face. Okay. In our present day Nigeria, you have just retired. What would you say formed part of the challenges that nurses face?
Wow, nurses face a lot of challenges in Nigeria. Apart from the fact that we are few compared to the number of patients you have to cater for. International law stipulates that at least a nurse should be entitled to care for 5 patients. But here in Nigeria, you see nurses, one nurse on duty catering for 50 patients, catering for 30 patients. You are up and about. That is a major challenge. Number 2, equipment. our hospitals are not well equipped. So in most cases, you have to make do with what you have, or you supplement, which in most cases does not augur well for the smooth running of a care. Number 3, nurses are not being appreciated. You can come to work resume work by 7:30, you work till 4 p.m., depending on where you are working, because if it's a government hospital, you sure run 3 shifts. But if it's a private hospital, it's 2 shifts. A nurse will resume duty at 8 a.m., take care of all the patients, close by 6 p.m., and to crown that up, you are insulted. No word of appreciation. We are all human beings. And in that case, what do you think the nurse should do? So it's most of the challenges we face here.
You have stated the challenge of poor remuneration, the challenge of patient to nurse ratio, and also you have also stated the fact that they get overwhelmed. But how then do you think these challenges affect the quality of the nurses that we churn out from our School of Nursing all over the country?
Well, in School of Nursing, the quality is still there. Yeah, the quality is still there. Even more now, because you are exposed to a lot of information from the internet, unlike in those days that it's purely what you are taught in class. But now you have more avenues to learn, because you can just, with a click now, you go on Google, go all over the place, and you gather more information. If not, the quality of training now is more than what we got during our own time. Yeah.
I understand the role of emotional and psychological stress on a nurse. Now, this now brings me to the point where I'd like to ask, we have heard complaints from a number of patients. You stated earlier now that the nurses have been insulted, but then we have, on the flip side, we have also heard from a number of patients where they're saying that the quality of service they're getting from these nurses sometimes are poor, maybe because they are either unprofessional, they are maybe raising their voices or not administering their drugs or injection. Just the service, the care, it's not the way it ought to be ethically. So what role would you say the emotional and psychological stress plays, and why is this happening?
Well, it depends from the angle from which the patients are complaining. Like we know in Nigeria, a lot of patients do not like, a lot of an average Nigerian would rather want to patronize a private hospital. And I can assure you that in private hospitals, it's not everybody in white that is a trained nurse. Because most of the proprietors or proprietresses of those hospitals will tell you they cannot afford to engage in paying qualified nurses. So what they do most of the time is go to the streets, bring in somebody, and train them on the job. So you cannot say the quality of the person you trained of the job can equate with that of the person that was trained by an institution. That's one. Number 2, I've told you, nurses are overwhelmed with work. And in that case, you cannot expect a quality care at the end of the day. Somebody can be tired, maybe she wants somewhere to sit down, lay her head for some time. A patient is nagging. I'm talking to you, come and attend to me. I mean, we are all humans. At times, you can flare up, even if you are a professional. So that's what we get in most cases. Yeah.
Now, as an addendum to what you have just said, I'd like for you to state, what do you think would be the likely sanctions for professional misconduct? You have stated that some of those practices are mostly with private healthcare centers, but we have also seen some of these practices even with federal medical centers, for example. So what would you suggest as sanctions that should be meted out to some of these nurses that are unethical, especially by the union?
If you're unethical, you already know what your sanction will be. because you know, as a professional, if you are reported, you'll be brought before a disciplinary committee, and if you are found wanting, you take the punishment that is due you. So that you already know. It's not as if a nurse does not know when you are found wanting what befalls you. You know.
Okay.
Yeah.
Now
so if you report them to the appropriate quarters and they are brought before a disciplinary committee, because like we know, you cannot just hear from one-sided story, then decide to punish me. You also have to understand where I'm coming from, and you need to hear from me before any disciplinary action can be melted out to a professional.
Okay, we'll still come to the issues surrounding the council, but I'd like to draw your attention towards, you have spent a number of years in the profession and you're now retired. I'd like to hear from you, the practice as at then and now. What would you say are the comparison and say the advancement now?
Well, like I told you before, if it's in terms of knowledge is more now than then. But human behavior cannot be ruled out in any sphere of life. You can't truly not vouch for somebody who is professionally trained that he or she will purely apply to his training. That's the issue we face now. But overall, a lot of nurses, Nigerian nurses that have traveled abroad are doing perfectly well. Perfectly well. That I can assure you of. But within the country, we know we have godfathers here and there that can influence the behavior of even a professional. I've seen it. Somebody that was brought in by a senator can just stand, insult nurses, insult even the doctors, insult patients, because she knows if you report me, there's nothing anybody can do to me. So it's part of the decadence in the society, and that cannot be overemphasized. Yeah.
At this particular decadence, how has it affected healthcare delivery and service?
It has. Just like you have said, a lot of people are complaining that nursing is not what it used to be. And that is part of what is happening in the society. Yeah.
Okay. Now, you stated earlier that nurses have traveled abroad and they are doing very well. And now this brings me to the issue of brain drain in the sector. Earlier this year, the Registrar of the Nursing and Midwifery Council of Nigeria, Farouk Abubakar, said 42,000 nurses left the country in the last 3 years. And then last year alone, which is 2023, it was over 15,000. The number is increasing year by year to seek greener pastures. And still, the council, NMCN, in its revised guidelines, stated that applicants seeking verification of certificates from foreign nursing boards and councils must possess 2 years of post-qualification experience from the date of issuance of the permanent practicing license. Hence, the issue of certificates verification policy, which arose earlier this year and led to protests at NMCN's offices in Abuja and also in Lagos to express their displeasures over what they described as an attempt to hinder their freedom to pursue career opportunities, thereby asking the council to address nurses' welfare, salary scale, shortage of staff, and other rights, as reported by Punch newspaper. Now, some may say this was an avenue to clip nurses, to clip their wings, to prevent them brain drain. But what are your thoughts on this?
My thought is that we are all free human agents. I cannot train myself, and you want to peg me down because you gave me an employment. Most nurses are training themselves. And who will not work where you get better remuneration, where you get better benefits? I mean, I've worked for 35 years for Nigeria, and what is my pension now? You get less than 50,000 naira as pension. So you were on NHIS when you were in service, when you were earning money. Now that your pension cannot even feed you for a week. Most of pensioners have debilitating diseases, and you have to cough out money to take care of yourself. Once you clock 60, NHIS deletes your name from their system. And you have contributed to this institution over the years. When you are supposed to enjoy the benefits of your hard work, you are suddenly cut off from all systems. Who will be happy for that? Nobody. Because when you are supposed to have a government to take care of you, the government now denies you. So you go to where you work, earn your wages, come back, retire, and live on your money. So in my own opinion, those that want to go for greener pastures should be allowed to go. You didn't train them, so why would you want to peg them down?
I hear you on that, and but I'd like to hear your suggestions on what you think the Federal Ministry of Health should do towards improving the nurses' working conditions, allowances, and salaries, in line with the Council, of course.
Well, they should look into their salaries and remunerations. You can't believe that a nurse working day and night has a hazard allowance of 5,000. Hazard allowance in the whole month of 5,000. I mean, let's think of that. Can your child in school survive with 5,000 for 1 week? Then come to their remuneration, nobody cares for nurses. The salaries that nurses were on in the 90s was barely worked upon. That is what they are still on. When you talk, they said, it's a humanitarian service you are giving. Must you die because you are giving humanitarian services? Abroad, is it not the same nursing care that they do? Yeah, they take care of their nurses. Okay. Unlike in Nigeria. So Nigerian government, if you want nurses to remain, treat them as they should be treated. Just
very briefly, as a form of conclusion, I'd like to hear your advice to nurses still practicing on how they can better do their job, and also to patients who are also receiving care from these practitioners.
Well, nurses are nurses any day, any time. I know nurses in Nigeria are well trained. They know their ethics, they know their etiquettes, they know their patients. On the other hand, patients too should relate with nurses as their caretakers. Not seeing a nurse as a slave or somebody who is less important in the society. No, they should be treated equally as human beings. And a patient who is really a patient will appreciate a Nigerian nurse for the kind of care they render to patients.
Thank you so much for your insights. There we had Mero, Adah. And in summary, addressing these challenges and fostering collaborative relationships will improve staff retention, job satisfaction, and overall healthcare efficiency in Nigeria. Nurses remain resilient, resourceful, and indispensable in the nation's well-being. And that concludes this week's episode of the program, Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores, and get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I am Aisha, Salihu. Thank you so much for your time.